How can we prevent menstrual disorders? Severe associated with vomiting. Imagine I only have 12 minutes. Now, there are so many menstrual disorders. So many. So many. There are some that we give contraceptives, interestingly enough, just to, so unaweza pata somebody has irregular menses, etc, etc. So it depends. Different people have different things. So you may find somebody who has irregular menses. We need to control it. If she desires fertility, then it becomes more of a challenge because some of these pills I told you can be used to regulate menses. Then you're able to use the so-called calendar, but for conception. So it depends. So ideally, we need to sort out what is the cause of the menstrual disorder so that you're able to treat the cause. Unanielewa? Ni kama njaa. Let me give it an example. Tukiwa na njaa, the treatment for hunger is food. True? Treatment for hunger is hata uoge, ukuje gym, uimbe praise and worship, ulale, uamke, hauta treat hunger paka ukule. Sindio? So menstrual disorders are caused by so many things. So that if you have hormonal imbalance, we treat them. If you have things like fibroids, we sort them out. If you have maybe endometriosis, we sort them out. So whatever a menstrual disorder you have, we have to find its cause, then now we treat the cause. So still, you may just have to have a visit to your gynecologist or to your doctor, then you're able to establish the cause. Because what will treat my menstrual disorder is a bit different from what will treat somebody else's menstrual disorder, because whatever caused mine is different from what caused somebody else's. Sawa sawa. I'm over 56. How do I cope with hot flashes? So this is mainly, I think, about menopause and some of its symptoms. Now, menopause is when you have cessation of menstruation. We usually diagnose it after you have had 1 year of ceased menstruation. For instance, when a female child starts having menses, they become irregular before body lewe maneno inafanyika nini, then inaelewa, then they become regular. So during that time of menopause, it becomes a bit irregular, and then now it becomes over. Sawa sawa. So there are several symptoms that can happen, and they depend on which system. In the cardiovascular system, unakuta you have hot flashes, where then after that, sometimes followed by fever, some chills here and there, then it comes here and there. So that's part of it. Other people may have genital issues where because of less estrogen, now you become drier, you have a little bit of pain or a lot of pain during sexual intercourse and things like that. So you probably have less vaginal fluid, less lubrication, etc., etc. The estrogen essentially is usually very protective. Rarely will you have a woman most men have more heart attacks than women. That is actually scientifically proven until we reach menopause, where that estrogen level has reduced, and then you're less protected like that. Then also the bone, some people have now brittle bones, etc. So unakuta mtu anaweza kaanguka tu kwa bathroom and probably have a fracture of the hip, etc., etc. All right? So one way of doing this is wellness. The first thing mulifanya hiyo, yenye mulisema muliamka asubuhi mkakuja na wengine in the sleep ministry hawakukuja. Exercise is good. Sawa sawa. Exercise is what? Is good. So it helps you it builds you and makes you a bit stronger to be able to sort yourself out. Because there's the creator who created, and those are things that we help to keep that creation working. Sawa sawa. Good diet, good nutrition is important. When you have healthy diet, balanced diet, good water intake, that is important. Sawa sawa. Occasionally, sometimes we give what we call HRT. HRT is what? I'll tell you. I think nimeongea sana. But it's like hormonal replacement therapy. Yes, HRT, okay? We give it, and it usually has a bit of estrogen just to to boost up, okay? And this we do with discussion, because this hormonal replacement therapy, it is good, it works, but some of that hormones will also bring some other issues, okay? Like if I give you estrogen, I also have to give you another hormone to a bit counteract it if you have a uterus. Because now some of this hormonal therapy can have a side effect, and part of the side effect can be one of those gynecological cancers inaitwa endometrial cancer, some of it. So ukichukua tu kivyako, you do not know which one it is that you need to counteract it. Sawa sawa, but it really does help. So keep a positive mind, eat well, sleep well, because then you regenerate well, healthy diet, good exercise, you can do a bit of reading. It also reduces senility, keeping your mind active, then you're there more often than not. Unanielewa? But it helps to reduce that. But HRT, hormonal replacement therapy, also does that. But we do it with caution, because things like endometrial cancer or breast cancer can also have an issue. Sawa sawa. With the fibroids, how is it sometimes pregnancy is successful, sometimes not? Number one, what causes high blood pressure after delivery? Can it come back to normal? Number two, dryness during sex, excessive. So fibroids, some people, now fibroids, I'll go back to my diagram. Unakumbuka diagram? Unakumbuka? This is the uterus. The fibroids ni uvimbe in the middle layer. Unakumbuka? Inside layer is the bleeding one. Unakumbuka? The middle layer was the muscle one. Unakumbuka? The outside layer was the covering. Sawa sawa. So when you have growth that's happening within the middle layer, then it is called fibroids. Sawa sawa. Interestingly enough, with people who are trying to read, refusing to give birth, so hiyo uterus ni kama inasema, usiponipe mtoto, nitajitengenezea. Alafu inatengeneza kitu inaitwa fibroid. Sawa sawa. So you'll actually find most of these fibroids with women who have delayed fertility, generally speaking. That's science. Sawa sawa. Now, if fibroids, because life is never easy, so si lazima itakuwa straightforward. Kuna ile fibroid that is going to grow nearer the endometrium, ile ya ndani, si ndio? Kuna ile itakuwa within the muscle itself. But kuna ingine iko tu within the muscle, but it is nearer the covering. Si ndio? Those fibroids will present differently. Why? The one nearer the covering iko far away from the bleeding layer. Si ndio? So unaweza kuta mtu ako na fibroid imejaa tu, hana bleeding disorders. Unakumbuka mtu ameuliza bleeding disorders. Sababu haiko karibu na inside layer. We'll find somebody who has fibroids, but it is nearer or touching the bleeding layer. Now that person will bleed. That uterus will bleed. So unaweza kuta somebody has a big one like this. In this layer, hakuna bleeding. Vai kendo. Unapata somebody has a small fibroid like this bottle top. See, literally speaking, 3x4, 2x2. Lakini iko inside the endometrium. Remember the inside layer? That person will bleed. Will bleed and bleed. Like, what is it? The guy is bleeding. So different people have different. Now unaweza kuta somebody who is pregnant, her fibroid iko huku nje. Huyo mtu si amebahatika. Ako na fibroid, lakini tasumbua kidogo. Si sana. Huyo mtu mwenye ako na huko ndani hata inamaliza space. Mwenye ako na 2 centimeters hata tunaweza iangalia mpaka afike menopause na isikue. Na kuna mwingine ako na 2 centimeters to decide kutoa, because it's bleeding. This person is always anemic, tired. Every time ako na menses, ana panic. Because some people even use 2 packets, not pads, 2 packets in 2 days. Yani yeye kazi ni kukaa kwa choo na kuchange. Alafu sisi tunapea dawa, It doesn't make sense. So different people are different. That's why I'm saying you treat them differently. Sawa sawa. Most people with fibroids, we actually prefer they deliver vaginally. Lakini, because life sometimes is hard, unakuta kifibroid kimedecide tu kukua kwa cervix. Itapitia wapi mtoto? Kimedecide tu for no reason. Today, I'm going to mess up Ouma's life. So, I shall be a fibroid within the cervix. So, you see now, you will have to deliver by CS. Sababu umefunga njia. You understand? And then now, as doctors, we fear fibroids and delivery, because delivery is blood. Fibroid is blood. Is blood. So utakuta tu tunakutransfuse sasa, because that fibroid, nothing can stop reggae. Ukute this patient ni wa Jehovah Witness, hataki transfusion. Wewe kama daktari unaomba off. Anyway, sawa. So next move, then now, what causes high blood pressure after delivery? Unachia mtu mwingine aumie peke yake. What causes pressure after delivery, and can it come back to normal? So now, this pressure after delivery, it does not happen only after delivery. So some people have high blood pressure. Okay, have 2 minutes. Oi, mutaninvite siku ingine. Sawa. So now this pressure, some people have hypertension in pregnancy. So unakuta, somebody has hypertension, hana pregnancy, but akona hypertension. Sawa. Okay. Then some people do not have hypertension. Then pregnancy imekuja. Then kashetani kingine, keusi kidogo, kanakuja, you have pressure. Why? There are some issues, we usually call it Vashus triad, all right? There are some things that, some of these pregnancy hormones, poor placentation, there's a way in which, you remember my diagram? Eh? Now this uterus, the blood supply to the uterus, inakuja, inaitwa uterine artery, just to make our life easier. Inakuja, inapita on the side, inakuja, inapeana huku, like that. So, your uterus, na branches, zinaingia, placenta inajitengeneza, kule ndani. So, kuna vile placenta pia itatoa branches, iguze ile uterine artery. So, that placentation process inaweza leta shida. And now that becomes multisystemic, then you find some people are prone to blood pressure increased in pregnancy. Sawa. Especially for elderly people like me who have refused to give birth. So you expect that it will affect such elderly mothers. Mungu nimekata. But then, but it happens, you'll find it more. People who have high blood pressure already, then wanaweza pata hii tena. The people who have diabetes sometimes may be prone to this. So there are other things that bring you to have a higher chance. This is just now a study of chance, okay? Sawa. Now, there are those people who can have a higher chance. Someone maybe who has a bit of obesity may have a higher chance than someone who does not have obesity. Someone who has something like sickle cell can have a higher chance. Systemic lupus can have, so things like that. Someone who has twins, when you have more placentas, refusing to placentate very well, you know, so things like that, okay? Sawa. But now, there are ways we do. So there are sometimes we give other drugs, such as junior aspirin. So we try to sort out that issue, or at least to delay, if it is supposed to come, to delay its onset to a point where we've reached where the child is a bit viable and can go well outside the uterus, even if they are preterm. Now, some do very well. Hakuna pressure in pregnancy. Ukishaza, inakuwa pregnant. Inakuwa hypertension. So it's just part of this whole system. It can come before or earlier before pregnancy, but still even after you delivered. That's why we usually go for those checks so that we ensure that we control it. The other question was, can it come back to normal? Yes, it does. It actually can come back to normal for more people than not. That is around 80% of the people, 70 to 80% kuna watu. But because I told you, life inakuanga tu na kakinyang'anyiro ya kusumbua watu, so there are some people who it may not come to normal, and therefore wataendelea sasa na high blood pressure medication. Sawa. So for most people, it yes will come. In fact, after delivery of the placenta, tunakumbuka nilisema uterine artery, sijui nini, placentation, nini, unakumbuka? So part of the treatment ni kutoa hiyo placenta, which means kudeliver. But for some people, inaweza kaenda more. Dryness during sex, excessive dryness. This depends. During sex, the woman has to be empowered enough to realize that it is important to have penetration when you're ready. You just don't land and shoot. Una shoot nini no meland sai. Women, we are a bit different, okay? We are wired differently, all right? A bit different from the gentlemen, and that's just fact. It's si kuongea mbaya, we are all adults here. We are wired differently, so you find that some people have the unfortunate experience of a spouse who is a bit impatient. So we amefika anataka kulima shamba, we bado uko stage haujafika. So chances are you are going to struggle a bit. So sex is beyond physical, it's emotional, it is psychological, it is a thing of two, okay? Sawa sawa. So it's good to have good communication, because for guys it's a bit different. For us, you have said, oh, I love you, you know this guy love you. You know, some people can just say they love you and they really don't, but their words, they're sweet things, okay? So, but women, we are more attached. There's the psychological aspect, there's the emotional aspect, physical becomes last, generally speaking. All right? I think that's how God created us, and that's just it, and we cannot apologize for it. Sindio, why are you apologizing for what God created as He created? It's a bit different. So I think for this particular reason, you should have a bit of communication, a bit of contact, a bit of ile kujuana, so that you're able to tell your spouse, how do we do it? This messes me up. This is okay. This I do not like. Would you, have that connection before you actually have a penetration? Secondly, there are other things that you can do. We can have external lubricants, but even by the time you're reaching there, please let's start with the beginning. Okay? Nilikwambia, however hungry you are, if you do not eat, ukienda kulala, uonde, ukuje gym, bado hautashiba paka that hunger, you treat the cause. So sometimes we even have people who are called sexologists who can help us with that. But remember, sex is not a matter of physical alone, at least for the woman. There's an emotional aspect, there's a psychological aspect, there's a physical aspect. There are all those aspects put together, and I believe communication does a lot. Nagikatana, there are sometimes lubricants that can be helped to help with that. Explain why the vagina should always be washed with cold water compared to hot water. Nani atanisaidia? Nani atanisaidia hapo tafadhali? Explain why the vagina should always be washed with cold water than hot water. Si tuko na jibu? Tumesema ni nani? Tumesema vagina is? So, wachana na maji moto, wachana na maji baridi, wachana na omo, wachana na vizo vyote, wachana na yogurt. Mungu aoshe vagina na lactobacillus na acidity. Sindio? Otherwise, you will visit us. Hakuna haja. Si afadhali ukuje gym? I'll finish that. What are fibroids and what causes them? Have I answered this question? Okay. So you can leave it now? Asante. How can I maintain the vagina free from infections during releasing the waste product? Have we answered it? Yes. So I can leave it. Basically, self-cleansing and fundamental hygiene. Sawa sawa. Mbele tunyu. Achana na sterility. Kila mtu abaki kwa linear. Asante. Sawa. How to reduce weight? Hapa ndio sasa tumeingia. If we are not supposed to clean the vagina, how about the ones that remove smell out of it, and after conception, when it's a bit wide, how do you handle it to come back to its normal size? 3, what is safe for cutting hair down there in the gated community? 4, exercises to be done to reduce vaginal size. 5, what is hemorrhoids and how are hemorrhoids treated? So thank you so much for this reduction of weight. Reduction of weight is a thing of two. Trust me, it is easier said than done. Okay? It's a thing of two, but it is easier said than done. So for me, I tend to think the most important part of that is discipline. For what is this that is easier said than done? Sawa sawa. It is about intake and exit. Sawa sawa. So be careful what you take. Sawa sawa. Be careful what you take. we are falling into the easy trap. Like kwanza hiyo sisi kama mimi I struggle with it. I think it's just the Lord who has helped me. Mimi nikichoka kale kama mtu kanazaa na fibroids na ni CS na nimetoka hivi nikifika nyumbani I just eat loaf and tea and sleep. Pathetic, status pathetic, as I know it is wrong. And I tell myself, Aki, Effie, this is wrong. Then now the body says, lalabas, nini. You see, indiscipline. And I know it. So balance diet and try to expend that energy because there are several things. Refined sugars find very easy ways of being stored. Unaona? Refined sugars zinastoiwa tu. Yani, ni kama hii mwili iko attracted, nachukua tu. So afadhali upe hiyo mwili kazi ngumu. Ifanye nini? Isage. Once it is sagaring, it's also using energy to saga this thing. Unanielewa? Now, some people have gone to nutritionists who have given us opportunities and diabetic diets and tell us to reduce especially the carbohydrates. And if you are to take carbohydrates, take the wholesome ones. It will give the body a run for its money. You understand? Yes, but it's about mostly exercise and diet. That is easier said than done. I think discipline do it as idea. Sawa. And interestingly enough, this body inasikiza na inati. Do not be fooled. I am sure I'm saying this because I have been to boot camp for 6 months. Mimi na hesabu yangu yote na biology yangu yote nilifika military wakaniambia weka hiyo kitu kwa kit bag. Weka chini sasa. I'm telling you, body iliti. Personally, I've been small-bodied, generally speaking, so I was much, much smaller. So I'm the few people who gained weight during boot camp. The few, where few is less than 2%. I gained 4 kgs. That's the only reason my mother was happy nilienda KDF. Alikuwa amepiga tu kelele kila siku. The only reason alifurahi, the one only, is because I gained weight. 4 kgs, I never got it. But most of my colleagues who are more blessed, walikuwa kipoteza like 30 kgs, 20 kgs in 3 months, 2 months. Why? Because yani kazi yenye walitufanyisha, let me tell you, if the Lord were to come during boot camp, I will go to hell. Why? Because matusi nilitukana au trainers huko ndani ilikuwa mbaya. You know? But I discovered this body in a tea. It's the discipline. Those guys used to wake us up at 3 a.m. It is time created by God, but it's such an ungodly hour. And you sleep at 12. Kimbia huko and you're like, nilifanya nini? Kwani sikuwa na maisha? You know, but guys lost weight. So I think it's more of discipline, persistency, and what you take and the exercise you use to expend. But it's easier said than done. So when you guys say you're coming here at 6:30, try. And I think for me, it has been easier when I have buddies. I'm going to talk about the social aspect of it more than the medical aspect. It's easier to have buddies. That's why I appreciate this whole team for bringing, because then at some point you have maybe a running club where munaenda and you clock in every day. I'm doing, na unaanza pole pole what your body can take. Unaanza na 100 kilo, not 100 kilometers, what was I saying? You can start with maybe 1 kilometer, then day 2 umefika 1, day 3 umefika 1, day 4 mwili mezoea, day 5 mwili mezoea iko sawa, and you realize it's kidogo. Then now you start 200 or 2 kilometers. Sindio? Then you do like that. And when you have a buddy, this person will be like, hey, Effie, si tuende? Nini? Oh, mi naenda leave. Okay, most of the time as we have excuses, I'm busy. No, it's more of discipline. Create time and it's easier when you do it together, because when you're together, you can go far. Sawa. I think I've not done very good justice, but I think it's more of discipline rather than that. Secondly, if we are supposed to not clean the vagina, how about how to remove the smell? Now, apart from yeast infection, there are other smells that come, especially if the vagina is contaminated. Sindio? If the vagina is contaminated, so what we do is let the vagina do its thing. Sometimes we give medication to that. So ukipata that you have vaginal smell, vaginal discharge, then it's okay to go to the hospital, come we check it out, because there are different kind of vaginal discharge that are treated differently. You can have the milky discharge that is yeast, that we treat with anti-yeast infections or antifungal infections. We can have others that are bacteria in nature. So nimekwambia kuna bacteria mingi elsewhere. Then you can have those that we have to treat with antibacterial infections. There are things that are called bacterial vaginosis that are affected. There are those vaginal infections that are sexually transmittable, and there are those that are not. So it's okay to go see your medical provider so that is able to distinguish what is this that is sexually transmitted, so that is given medication for you and your spouse, and there are those that are just given for you alone. Sawa. And sometimes remember those things that I said: clean area, non-cleansing, sterility, unaweka kule nje, indirect sunlight, remain dry, cotton panties. They actually sort 85% of that issue. Sawa. What is safe for cutting down hair down there in the gated community? Different people have different preferences. Kuna watu wanapenda uchungu, wanaweka glue, wanafanya sindio? Kuna watu wengine wana shave. So different people have different preferences. Now, I don't know whether you have seen gentlemen who shave their thingies, the beard, and then they have dundos. You've seen those ones? Okay, so unaweza kuta you prefer that, but you have that thing called folliculitis. So it's part of infection getting into those follicles. Then sasa unatengeneza those down there in the gated community. So different people's gated community react differently. Unanielewa? So there are those people who are okay with just shaving using the shavers. There are those who are okay with doing the waxing. There are those who are okay with that thing that just, But if you cut and you feel this is not working for you, it's okay, because there are other alternatives. Sawa. Usikufe nayo, sababu nilisema sijui. No. Because what will work for me may be different from what will work for mom, may be different from what will work for somebody else. Sawa. And some people are just okay with trimming with scissors, by the way. I have some clients who they don't like the waxing, but the shaver causes the folliculitis. Afu nakuta wanajikuna, ina form dundos, then now we have to treat. Then now you see, and I decide, okay, I won't reach that thing. I'll just trim. So look for what works for you, what best works for you, and do with it. Whichever you decide, it is okay. Other than rhesus factor and estrogen levels, what causes miscarriages, 2 months and below, and is there a solution? Okay. Now, there are so many things that cause miscarriages. And remember, I put it in different trimesters. Munakumbuka the 3 trimesters? First, second, third. In the first trimesters, nilisema nini? Munakumbuka, there was the issues that are intrinsic to the conceptus. Sindio? Uyo kiumbe ambayo ametengenezwa, the issues that are intrinsic to them are the main causes in the first trimesters. Most of the time, there might be nothing you'll be able to do. Sometimes, there'll be something you'll be able to do. And especially so, if you have chronic conditions. Therefore, what we usually advocate for is when you want to conceive and you have a chronic condition, then it will be good to have a preconception counseling where we look at you, what you guys were doing up. You look at the pressure, we look at the sugars, we look at we look at everything. We look at your weight, we look at your height, we look at your BMI, we look at the medications that you're taking, because some of those medications are good, you need to take them, but they're also not good with pregnancy, so that if there are things that need to be changed, therefore we change them. Sawa. Now, there are some things that are also for the mother, like amesema other than rhesus factor. Maybe I'll explain kitu kidogo. Rhesus factor, you know the blood group types? Kuna AB na O. Then it can either be positive or negative. So the rhesus factor is that positive or negative part. Okay? So unakuta some people, like as a mother, okay, let me answer this with a question. Have you ever heard about chicken pox? You've heard about chicken pox. This chicken pox, how many times, assuming you get it how many times do you get it in a lifetime? Once. Why? Eh? Now what happens is the body it sees the chicken pox, it fights it. Sindio? After it has fought it, inabakisha memory. So it kills this one, it fights it, then it leaves a drive. It leaves a memory. Sawa. Then sasa ikuje next time. This memory, umenizoea. Sindio? So it proliferates and works it out. Unaniget? So it's not that you get it once, but it affects you once. Because the body, I'm always telling you, the designer is perfect. I cannot see how you can be an atheist and you're a medic. To me, it doesn't. Anyway, wacha niache hiyo. I was brought here to talk gynecology. So the body will remember and it will fight. So if a mother is rhesus negative, she gets blessed with a baby who is rhesus positive. That is where it works. So the rhesus positive part, sometimes we have, the mother is a whole different system, the baby is a whole different system. They're just sharing the compound only. And mostly the baby uses the mother, but generally sharing the compound. So sometimes we have mixture of this system, where there's fetal to maternal to transfusion. Kidogo, unaona? So the mother who is negative, si yako negative, huyu ataangalia hii, si ni positive. Hii kitu ikikuja hapa, what does it do? The mother anatengeneza antibodies. Si ndio? Anatengeneza antibodies because there is a foreign thing here. Wacha nitengeneze next time, utaona. Okay? So the next time, so this baby will be born well. Okay? Born well. Mzuri tu, sawa tu, baby number 1. The mother conceives baby number 2. Ako positive. That baby, akue rhesus positive. Mother alishatengeneza KDF. Si ndio? Sasa anaona this. Umezoeana. Created is going to fight this positive baby. So that's why unaona ile immunity. Unakumbuka niliambia immunity goes down. Those are the things that happen. So what we usually do is, before any fetal maternal transfusions, we usually dunga, there's something called anti-D. Sawa. So that this mother adungwa anti-D asitengeneze hizo mavitu za kuremember for the next. So this anti-D protects this. Actually, does not protect this. Protects the next possible baby. You get? You're not getting for this one. You're protecting for the other one that I might form antibodies against in future. So that's part of it. And then other things, other factors that can cause miscarriages. Unakuta, remember this anatomic factors? Kuna cervix inakuwa insufficient enough. It's supposed to hold that uterus, a lock. Takana ifunge hii kitu paka huyo mtoto ashibe until the cookie is cooked, okay? But now it becomes insufficient, it opens up, therefore it becomes an issue. Sawa. Even if I go maybe from huku, first of all, there are things that affect even conception huko. If the mother is forming antibodies against sperm, it can also happen. Si tunaanza chini. It does happen, immunological factors. The cervix can be incompetent. The uterus can have issues, for instance, things like fibroids sometimes inaweza sumbua occasionally, okay? If especially the fibroid is in the place where you're supposed to implant. So where does this fetus implant? Inasumbuka kiasi. Or it will decide to implant uko chini, then unakuwa na placenta previa, you keep bleeding and you have to sort those things out. Sawa. Then you can have anatomical issues. Usually, how this body, how the genital system is created, it is usually like a tube. Hii tube inakuja this side. This tube comes here, 2 tubes meet together. That is when you are in your mother's womb. Okay? Inside Uko, I knew you in your mother's womb before you were formed. That before, it's during that formed. That is the time. This tube comes this way. This other tube comes this way. Zinakutana hapa straight. Then these are 2 tubes, sindio? Then in between the 2 tubes, those 2 walls, they get resolved. Then it becomes one big tube. It makes the uterus. Then things like that. Okay? So unaweza kuta some people have one side. You get? Hawana hii side. Wako na hiyo side moja. You understand? Therefore, that becomes an issue because there's no space, the muscle is less enough to carry, things like that. Those are anatomical factors. There are other systemic factors, tulisema diabetes, hypertension, etc. There are other things like lupus. There's so many other factors, okay? So ideally, what I'm saying is different people, we have different reasons for different miscarriages. Unanielewa? So for a person with miscarriages, that's why I'll keep talking about preconception counseling, so that now we are able to see what is it, and then we sort it from there. And interestingly enough, there are others we still do not know. Where the doctor is an idiot, the patient is pathetic. So there are still those ones that we also do not know. Sawa sawa. Okay. What is the cause? So as I told you, everything in medicine, inakwanga, look for the cause, then treat the cause, because there are different causes for different people. So rarely will I tell you a specific answer for a specific question. It's just good for you to understand generally, but rarely will I, most of the time, I may not be fully, until me and you have a one-on-one talk to see what it is for you. Sawa sawa. Why are some periods very painful than others? Like, for example, this is not even painful at all. Then the next is a bit painful. Then the next one, I can't even get out of bed because of the pain. Is nausea a normal symptom when you are in your period? So remember I said other people react to pain. By the way, pain itself is subjective. I'll give a very bad example, because I believe this place has forgiveness. Sindio? See, this is a hall that has forgiveness, so I preempt sin. Anyway, so I'll give an example of different maternities I have worked in. If you work in a place in the western area of this country, their pain threshold is so low. So the kind of choirs that will entertain you during that maternity process is high, okay? Because they perceive pain differently. Different, okay? If you work probably in Muranga, they'll be like, you get different people perceive. Please forgive me. I'm just trying to say pain also is very subjective. But what is pain to you that will cause you to not go to work? It should not happen. However subjective it is, all right? So that will require a medical checkup. Ndio tuangalie what is its cause for you. Sawa sawa, because it's subjective. Zingine we may just find iko tu sawa, then like I always tell patients, I'll give an example of headache. Headache for some people is just because uliona Dr. Ouma aliongea sana, akachukua muda mrefu, ukapata headache. Si ndio? Unaweza kupata mtu mwingine ako na hypertension, pressure iko juu, akapata headache. Mwingine ako na stress, akapata headache. Mwingine ako na njaa, akapata headache. Mwingine ako na cancer, ama mtu mwenye ako na endometriosis ikafika kwa kichwa. Remember I told you that endometrium going elsewhere. Such a person, if it's here, itapata headache. Or maybe some issue. So different people. So headache can either be innocent or guilty. All right? So when you have persistent headache, then we test, then we say, okay, this headache has no love lost. We can deal with it. This headache has issues. Let's sort its cause. So it's the same thing about painful menses. There are those people who have lots of pain, and probably they have issues. Maybe wako na hiyo adenomyosis, maybe wako na endometriosis. Other people, unakumbuka I talked about infections kule, then you have You heal with fibrosis, some of those things we call adhesions, then they entrap the nerves, then you're always in pain. So for different persons, it's usually good to check so that we find what are the causes. So unaweza kuta, we can treat the pain, we can always treat the pain, we can always give painkillers, we can always reduce the amount of blood, etc. But again, it is important to know, as we are treating this pain, what is the cause of your pain so that we treat that cause also. Sawa sawa? Is it understood? Okay.